Hello, welcome to Engineering and Ventilation for COVID-19. This is our fourth in our six-part webinar series produced in partnership with the Washington Department of Labor and Industries. Recapping some of what we know now about COVID-19. So originally it was thought that this virus only impacted the lungs, but we found it's much more systemic than that. It impacts your lungs, your kidneys, your heart, your brain, your blood vessels. There's a lot of impacts that we don't even fully understand at the moment. Another huge change in our understanding of COVID-19 is the means of spread. Originally, we were really concerned about surfaces and touching things and touching your face and getting sick that way. We've since recognized that COVID-19 is primarily spread through airborne and droplet transmission. And I'll go into what the difference between the two on the next slide is, but fundamentally, airborne transmission refers to aerosols, which are very, very small particles that can linger in the air for up to 3 hours. Droplets are also very small, but they're bigger than aerosols, and they typically fall to the ground within 30 minutes. Just talking in a regular voice can produce droplets that linger in the air for almost 15 minutes. The image on the right is from a study where they hooked a mannequin up to a fog machine and had it expel fog to simulate a person coughing. And then they used a laser to measure the amount of leakage from various types of masks and no masks. So coughing with no mask in this study, the particles traveled 12 feet. Once you used a homemade 2-layer mask, the spread was limited to 2.5 inches. So that's the top image. They mostly had leakage from the very top, which settled on the person's face, the mannequin's face. And then even using a single layer bandana, it limited the spread to 3 feet. So even though bandanas are not typically allowed in most workplaces and not the recommended form of face covering, they are still significantly better than no face covering at all. So again, the aerosols are very, very small. They're less than 5 microns in diameter. And then droplets are greater than 5 microns in diameter. A fomite is an inanimate object that can help spread disease through contact, like a doorknob, a light switch. These are not the main route of transmission. That's what I was saying earlier, where we used to think it was surfaces, and it's just really not surfaces that we need to be worried about. We still do want to clean everything, but it's preventing this airborne and droplet-borne spread that we really want to prevent. The survival time of the virus is not very long outside of the human body. The half-life is 6 hours, which means if you were to cough out 1,000 virus particles, 500 of those would not be able to infect anyone after 6 hours. Another 6 hours, you're down to 250 viable particles. Droplets may help the virus survive a little longer because they have saliva mixed in with them. And they also might have a larger viral dose. So droplets may be more infectious than the aerosols. Planning for a safe return. The image on the left is the hierarchy of controls using infection control principles, which are means of reducing the spread of infectious diseases. So the number one thing you always want to do is elimination. In some cases, elimination is having your people work from home if they're able to, but not every job can work from home. So other methods of elimination are filtration, air purification, disinfection of surfaces, even though surfaces don't play much of a role in COVID-19, they do in a lot of other illnesses. And then engineering controls, that's the barriers. So engineering and elimination are what we're going to talk about here. Administrative controls, that's more on training your people, setting rules on the spacing, so everyone in your office is at least 6 feet apart, things like that. And then PPE is considered the least effective thing. And that's not because face masks don't work. Face masks definitely work, as we saw in that study. It's that people have to choose to wear their PPE, their personal protective equipment, correctly. And it's always harder to have a human variable. So you always want to use elimination and engineering first before you do anything else. So the American Society of Heating, Refrigerating, and Air Conditioning Engineers, ASHRAE, has tons and tons of free resources on reducing disease transmission through ventilation. And I'm going to switch the screen share and take you to the page that I've linked down there. So this is the technical resources for COVID-19. And there's the core recommendations that I'm actually going to go through on this talk. There's frequently asked questions. There's a single page guidance document. The whole point of this is that it doesn't have to be scary. You don't need to be an HVAC engineer in order to improve the air quality of your workplace. And I'm switching back. And that's what we're going to go over here. There's a lot of very cheap, inexpensive ways to really help your situation without having to have too much technical knowledge. So the core recommendations, the ASHRAE Epidemic Task Force created these recommendations that said, and the whole concept is within certain limits, ventilation, filtration, and air cleaners, that's like a portable HEPA cleaner, you know, those are very popular. They can be used to reduce the exposure to different diseases. And you can still do these changes and enhancements while still having your people be comfortable, not using too much energy, and not going overboard with the cost of all of this. They set the targets for the clean air supply rate, which we're going to talk about, the filter performance, talk about different types of air cleaners and other types of removal mechanisms, things that eliminate the virus from the air system. You should always be following all of your regulatory requirements as far as social distancing, mask training, the number of occupants, the circulation of occupants. So it's always better to not have people in a fixed position for a long time. You know, if you have an open concept office plan, we're going to talk about how to build in better barriers and ventilation so people are not breathing each other's recirculated air, and also just hygiene and sanitation rules. So ventilation. Increase the circulation with outdoor air and fans. That's a super easy thing you can do. You open windows, open doors, add in fans. Do not have a fan pointing from one person to another person. You know, have fans circulating air, but don't blow basically someone's used air onto someone else. And we'll talk a bit more about a really cool study they did on that. Increase the amount of outdoor air used to the highest amount your HVAC system will allow. That you're going to need to look into your specs and see what your system can handle. because not all HVAC systems can add in a lot of outdoor air, but there's also filtration systems, and we'll talk about those more, that you can use if your system can't bring in a lot of outside air. So aim for a minimum of 6 air exchanges per hour. An air exchange is if you were to think of a room, think of the volume of air in the room. One air exchange is the amount of time it takes for all of the old air to get sifted out and be replaced with new air. So 6 air exchanges per hour. To give a comparison, a medical non-COVID room, like a hospital room that's not for COVID, would have about 12 air exchanges per hour, or like a dental office, things like that. Before and after work, flush the space for 2 hours using outdoor air. That is a recommendation. Not all HVAC systems are going to be capable of that. But if your HVAC system isn't capable of that, open windows and doors. Bringing in the outdoor air is the best thing you can possibly do to protect your workers. And then put people in the areas with the cleanest air, and that's clean to less clean airflow. So if you have 2 offices and one office gets the recirculated air from the first office, you can have a person in the first office and then maybe store supplies in the second office, so that you're not putting another person breathing in person A's air. Provide and maintain the minimum required outdoor airflow rates. So most HVAC systems do have a certain amount of outdoor air that's allowed. You may not be able to max it out and do the 2 hours of flush before and after, but make sure you're at least meeting the minimum standards your system was designed for. Use air filters and cleaners that achieve a minimum efficiency rating value of 13 or better for recirculated air. And we'll go into what that actually means on a later slide, but it's a higher level of filter that still works for most HVAC systems. It's also what you want when you have a lot of wildfire smoke, things like that. Use only safe and effective air cleaners. So a lot of air cleaners, the pourable ones, have ozone as a byproduct, as the advertising is that it's something desirable. You definitely don't want to increase ozone. Unfortunately, UV filters in systems, they get a lot of hype, but they're really not necessary for COVID-19 or very many viruses or bacteria, and they do produce ozone. So you might end up in a situation where you spent a lot of money on a UV system, and now you have to do worker exposure assessments to make sure your workers aren't getting exposed to too much ozone. Wherever possible, go for an energy efficient model of an air filter, air cleaners. Do we have any questions at this point in the talk?
Yes, it looks like we have one question. So it says, if everyone is vaccinated, do we go back to pre-COVID ventilation?
You technically could. I really like some of the increases, and I do think in general, outdoor air is really useful for preventing things like influenza. The nice thing about the MERV 13 filters, though, is at least on the West Coast, we have terrible wildfire issues. And we often have a month or 2 months of the year where the air is unhealthy and you cannot bring in that outside air, and you can't just open a window. So having those higher level of filters that get the particulate out of the air could be really beneficial. So some of it's just going to depend on what your company decides to do to increase their COVID-19 like air system capacity. But I think there's a lot of really good things for human health that come out of having a more efficient air system. So I would say keep what works for your system and lose anything that puts unnecessary strain on your HVAC system. So this is going to go into these MERV ratings. So a minimum efficiency rating value. And then there's also high efficiency particle air HEPA filters and their percent effectiveness. So you want to increase the amount of filtration as much as you possibly can without compromising airflow. So you want those 6 air exchanges per hour. And what this means is it's really hard to pull air through a HEPA system. You probably cannot do HEPA in your basic commercial building. You can do standalone HEPA filters, but for your basic building, if you can aim for a MERV 13 filter, that's still going to get between 50 and 85% of particles, 0.3 to 1 micron in size. So that's smoke, that's the droplets. And I talk about this a lot in masks. Yes, COVID-19 individually is about 0.1 to 0.3 microns, so very small. But it's very rare to have just a single virus particle. You're mostly going to have it in droplets or combined with other virus particles, even the smallest aerosols. And also how these very small particles travel, it's not like they worm their way through a filter. They often just get stuck to the filter surface. So the MERV 13 or higher ratings, if they work for your HVAC system, are going to be very effective. But they will put more strain on your system. So just make sure your system can handle it. And then HEPA filters are great if you have, a worker that has to be in one area all day, or you do have an open concept. You can put a portable HEPA filter and just make sure it doesn't produce ozone near the person and use it as a source control. Purification. We're honestly only going to talk about filtration in this, besides mentioning again that use of UV light can produce harmful things like ozone, and also the light is harmful to the skin and the eyes and things like that. So filters are going to be the best bet for the average system. And then in a filter, the virus is still active. We don't think there's much risk from surfaces, but it is possible if you did have active COVID cases, it's possible the virus would still be active on the filters. But since it doesn't survive very long on surfaces, if you just waited a couple days and used appropriate precautions, a mask and gloves to do any changing, it's really not going to pose that much of a threat that the virus is still active. So air distribution, you can add in fans, things like that. Again, do not aim the fan in such a way that it could produce person-to-person transmission. So don't point the fan at one person and then have that airflow going to the next person. There's a really cool study they did. In general, studies found up to an 18 times increase of transmission for indoor environments. So this is a study from a restaurant in South Korea. One person, B on this diagram, person B was able to infect 3 people, one of whom was only in the restaurant for 5 minutes, and that person was 20 feet away from person B. So person B had COVID-19 and had a meal with person D situated directly across from them, and person D got sick after eating across. Well, this restaurant had no windows, but it had a very active air conditioning system that blew fairly strong air from 4 directions. So one air hit the wall directly behind person B and basically swept up person B's droplets and aerosols and directed them in a straight line like a blade after bouncing off the wall, and infected person C, who was about 15 feet away, and then person A, who again was 20 feet away and only in the restaurant for 20 minutes or 5 minutes at the same time as person B. So the increase in air pressure and the directionality, that bouncing off the wall, it made those larger droplets that contain higher doses travel much further than their normal 6 feet. So masks should always be worn indoors. Distancing should always be maintained, and people really shouldn't linger in shared indoor spaces. I'm very sympathetic to restaurants and everything they're going through right now, but ideally people really should be eating outdoors or getting takeout until we reach a level of vaccination in this country that would allow for indoor dining again. HVAC system operation, these are the bare bones that anyone can understand. If you have more technical issues or an older system, or you want to do a lot of revamping, you're going to want to hire somebody to come in and help with your system. But anybody can do these points. So you should make sure the temperature and humidity are at the correct points for what the system was designed for. So you look at the specifications and make sure everything matches. You should have a clean air supply for the amount of people it was designed for, the occupancy that the system was designed for. When you're doing a flush, which is where you bring in clean air into a space, aim for at least 3 air exchanges during the flush. And then try wherever possible to not let contaminated air come back into the building from like an outside air intake or things like that. And, you know, just make sure your HVAC system is functioning the way it was designed to function. Before we go on to barriers, do we have any questions about HVAC systems, ventilation, filtration?
Yes, it looks like we have another question. It says, how can I increase ventilation at home to help protect my family from COVID-19?
So home, that's an interesting question. So what you do at home is a direct reflection of the amount of risk and variables from outside the home. So if you have a healthy family that's all working from home, doing school from home, you have very, very limited risk. In general, I would say with them, the cheapest option, open windows, open doors, things like that. If you have high risk of, you know, someone getting sick or situations like that, you can increase your home HVAC filters to those MERV 13 filters. Like I said, they have a lot of benefits, during wildfires, things like that. They do filter out the smoke and make for healthier air. So they are not a bad idea to get a hold of. And then if you had someone actively sick in the household, you would want to isolate them as much as possible, and try to make sure they're not sharing airflow or recirculating airflow. So again, open windows, open doors, use those MERV 13 filters, and barriers in that case wouldn't be the ones we're going to be talking about, but make sure doors are shut. The person, should they need to go into any shared family space, they should be in an N95 respirator or KN95, and just do whatever they can to limit the that recirculation of the dirty air. All right, barriers. Right now, barriers are very helpful if you have places where you have no choice but to bring workers back in, or where people are interacting with the public, or if there's any sort of open or community workspace. So before you do these alterations, see if you can reduce the number of people that are going to be in the space, reduce the occupancy. So there should always be a minimum of 6 feet of distancing, and that's for mask wearing people. If your employee can work from home, please allow them to do so. That's the best possible way to eliminate exposure to the virus. And then again, you need to wear the face coverings and practice good basic hygiene. So when you're thinking about making a barrier, you need to consider how easy is it to clean? Are they going to be tall and wide enough to protect an employee who's both sitting or standing? Do they protect the breathing zone, which basically pretend there's a dot on your nose and go 1 foot out from your nose in all directions. And that is your breathing zone. That is where you are in the most risk of inhaling particles, infectious particles. Wherever possible, make the barrier at least 6 feet tall. Make the barrier at least 26 inches wide, but wider is always better where feasible. And then in this example, I just wanted to note that if this teacher was teaching to a classroom right now, she would need to have a mask on in Washington State, because a barrier alone does not eliminate the need for masks unless the person is completely isolated. Another thing to keep in mind, you don't want your barrier creating additional danger. So you need to still have the same amount of access or egress. Your emergency exits should never be blocked. You need to not block smoke detectors, sprinkler heads, carbon monoxide monitors, fire extinguishers, or fire pull stations. So if you do have a sprinkler, the barrier needs to be at least 18 inches below the head. That allows the water to fan out in case of a fire. And then you need to have at least 2 feet below the ceiling in areas that don't have a sprinkler. Barriers and airflow. If you are adding temporary plastic barriers and you're securing them to a wall, they shouldn't exceed more than 10% of the wall area. And that's just to make sure your HVAC system and your ventilation are working as intended. And you can cut slots and venting barriers, but never in that breathing zone, which again is a foot from all directions from the nose. Shower curtains are a great affordable barrier system. Make sure they're secured safely. Make sure they're not, blowing up around or presenting any additional risks. So in the upper picture is a restaurant that's using shower curtains on PVC pipes. So just making sure that the PVC pipes are secured from the ceiling and secured in a way that can hold their weight. It's a great way to reduce exposure. A lot of hairdressers are doing that. And then this picture below, a friend of mine went and got a pedicure, and they had barriers that do protect the workers' breathing zone and also protect the patrons' breathing zone, and just basically a cutout for the feet to go through. So I thought that was a very clever use of barriers and a great way to protect the employees. Any questions on the basics on barriers before we talk about what jobs have the highest priority of needing a barrier?
Yeah, it looks like we have another question. What chemical is the best for cleaning barriers?
Soap and water is going to be really good, and the CDC did change their recommendations to say that soap or like a mild cleanser and water is effective for most COVID-19 situations. You know, if you're not cleaning up after a known case or in a medical situation of known cases. Alcohol will work on a lot of barrier situations. Never ever use bleach on a plastic barrier, because the bleach will cloud up the surface and make it so it's not transparent anymore. I don't like bleach in general. Bleach does a very, very good job killing just about any microorganism, but the vapors are known to increase the risk of asthma and just a lot of negative interactions if bleach gets mixed with anything other than water. So in general, I recommend people avoid use of bleach. Any other questions on barrier?
Yes, looks like there's another question. So it says, where can professionals who manage schools, offices, and commercial buildings get information on ventilation, filtration, things like that to respond to COVID-19?
The ASHRAE website at the beginning is going to be your best source, because it's all free information, and they do have it broken down into the different types of buildings and the different types of commercial systems. So that's going to be your best bet. If you need more personalized help, contacting an industrial hygienist like our company, we can come out and help with adapting your system. And then HVAC technicians too can do modifications. So it just kind of depends on where your system's at, what your technical understanding is, but that ASHRAE resources page is a great place to start. And this webinar is being recorded. It will be posted to YouTube, and we do have our blog and webpage for COVID-19 education. So these links will be available. Figuring out who needs a barrier. The highest risk people are food service, retail cashiers, medical screening areas, anywhere where people are getting tickets or kiosks, reception or information desks, and then higher volume shuttles and buses. We've got a great picture on the next page on how they are modifying buses for school systems, school children. And then this picture is a cashier and a temporary barrier. Like I said, this is a great system. They were able to make flexible plastic barriers that they could mount from the ceiling. So, you know, safe if there was a car accident, easy to clean, you know, easy to modify. So this is a great system they did for school children. And then I really recommend that the windows be down and, the kids can just wear jackets. Medium risk areas are considered open work areas. If your office has an open concept design, you're going to want to put in barricades, barriers, so that you can protect your workers. Lower volume retail, so that might be a clothing store. You'd want a barrier for those retail workers that are checking you out. Lower volume transportation, so that might be, a shuttle like to the airport right now isn't getting as much use as it normally would. And then the lowest risk areas that may or may not need a barrier depending on things are small private offices where they're able to keep everyone socially distanced, and then areas that have other controls that are just as effective as a plexiglass barrier. So, if you have permanent walls and a door or things like that, or permanent cubicle that goes to the ceiling, you're not going to need to add in an additional barrier. Do you have any questions before we start wrapping this up?
Yes, it looks like we have 2 questions. Are grocery stores / public buildings allowed to let people in with just a shield mask, excuse me? If so, is that a building policy or a state policy?
In Washington state, they are not allowed to do so at the moment. They are supposed to do, if someone has a medical reason they cannot wear a mask, those people are supposed to do curbside pickup or delivery. So if a store is letting people in with just face shields, it could be they don't have the resources to police that. It could be they don't know that somebody's doing that. But at the moment in Washington state, you need to have a mask as well as a face shield if you're going into businesses.
Great. Now, second question. How should people and coworkers commute together safely, or is it not safe if everyone is wearing a mask and is vaccinated?
If everyone's vaccinated and past their 2 weeks, 2 weeks post their second shot or first shot, if they're getting Johnson & Johnson, they can commute. If one person is vaccinated and one person is not vaccinated, they can commute, but they're going to want, at bare minimum, windows down, vents open. If it's a larger system like an agricultural van, they've actually been able to put in barriers, again, using shower curtains. They've been very high use during the pandemic. So they've been able to basically shower curtain off each row of seats. And then if neither are vaccinated, it's still possible. But again, masks, barriers, as much ventilation and outside air as possible, and as short of a period as time. It is not recommended, if neither is vaccinated, to do carpooling. And the only exceptions have been for the most essential workers in agriculture. So if everybody is vaccinated and past the point, it's still worthwhile to increase the ventilation because we are looking at variants and things like that. But you should be good to go. So reminders again, you want to use infection control principles to guide the decisions you make for your workplace. So elimination, you want to increase the ventilation and get rid of the dirty air, or work from home to eliminate the source. Engineering, you want to add in those MERV 13 filters and barriers where people are in high risk or medium risk work. Administratively, you want to train your people and educate them make sure you're not spreading any misinformation. And then PPE, you want to wear masks until basically the state reaches a level of herd immunity and we have a level of control over the variants that they do announce that masks are not required. And we're still a ways off from that. Face shields are a great solution if you find that glasses are fogging up, but you cannot use a face shield in place of a mask, just like in our question. Here's some additional resources. Washington State L&I has a full page of COVID resources. They'll break it down by business. They'll give you training materials, questionnaires. If you need to have respiratory protection, it'll help with that. The ASHRAE recommendations that we went through at the beginning of this talk. Cornell University has a fantastic page on barriers that will give you the specs as far as fire code and all sorts of different technical specifications. L&I Small Business, they don't have their own COVID page, but they are who we are partnered with to produce this, and they can help direct a lot of small business questions. Our page, where we have our webinar and blog, and like I said, we are filming all of these webinars and they will be available on YouTube, and you can go to our page to access these anytime you want. This is part 4 in a 6-part series. We'll be going into more virus updates and building your own infection control plan and information about the variants and just kind of where we go next in the next 2 webinars. So I hope people will join us. And then the resources for businesses for Washington State. One other thing that I didn't go into detail on this, if you are reopening a building that's been dormant, there's things like Legionella, bacteria in the water that can make people very sick with actually very similar symptoms to COVID-19. There's potentially mold, especially in the wet Pacific Northwest. And there's also lead and copper in the pipes. There will be a talk on our YouTube channel that I gave for the parent company on how to safely open a dormant building, taking into all those factors and giving a timeline. So that should be available on our YouTube page within the next week or so. The CDC guidelines for that, you just look up reopening a dormant building CDC guidelines, and the CDC also goes step by step for what you need to reopen a building. So this was very short and sweet. Please feel free to reach out to me with any questions. And do we have any other questions on this webinar before we close out?
There are no more questions.
Awesome. Thank you so much.